The pandemic is raising lots of safety questions for women planning on getting pregnant or those who may already be pregnant. Among them is, can a mother pass the virus on to her baby? Is it safe to be pregnant right now? Dr. Amy Evazadeh joins us from Danville. She's a fertility specialist. She's been doing this for 20 years in the East Bay. Thanks, Amy, for being with us today.
Thank you. Thank you.
Let's start with fertility. You're a fertility specialist.
Yeah.
Are you even doing cases right now?
Yeah, I mean, I never thought in a million years I'd be talking to patients about preparing for pregnancy during a pandemic. But now more than ever, believe it or not, as our priorities are now way more in focus, people are certainly coming to me and wanting to get pregnant right now. And they're so heartbroken because a lot of them, their fertility treatments have been placed on pause because of the pandemic. So yes, I certainly have patients reaching out, and I'm empowering my patients with a plan. I'm asking them to reach out to me every 2 weeks so that I can update them with what's going on. And when their cycle starts, I'm giving them an update and teaching them how to prepare for pregnancy. Right now, I mean, having control over this situation, control is always elusive, especially when it comes to pregnancy. But if you feel like you can take certain steps to prepare for what is, for most of us, one of the greatest journeys of our life, which is pregnancy, it doesn't feel as scary if you have someone who's guiding you.
Yeah, that is a hard pill to swallow for a couple that maybe had been planning for a specific time to get pregnant, or if they need help, if you're up against a biological clock, that you have a time set and all of a sudden something outside of you has put a stall on this. And as we all know, one of the things maybe many times is stress has a real impact on whether you can get pregnant.
Absolutely. I mean, I deal with stress every day with what I do, but now more than ever, I joke and I say I'm getting my cheerleading skirt on and getting my pom-poms out and teaching people how to deep breathe, pick a mantra, and have a fight song every single day. I mean, a lot of being a fertility doctor, people think it's like unicorns and puppy dogs and fireworks, and happy days. But a lot of it is dealing with human biology and the heartbreak that goes into trying to get pregnant. And certainly fertility doctors in the Bay Area are very well informed about the impact of coronavirus on pregnancy, and we want to do what's safe for our patients. So the good news is that our shelter in place might be opening up here soon. And so fertility doctors in the Bay Area will likely be starting treatments in May for patients who want to do a frozen embryo transfer or fresh transfer. And certainly for urgent cases, like for example, patients who have cancer, we are certainly able to help you and do egg freeze or embryo freezes. We are taking cases on an individual basis and counseling our patients about what's safe for them, given their medical background and if they have any health risks.
That's really good to know. Okay, let's talk about some of the considerations and things that you should be looking at if you're thinking about getting pregnant. What are some of those? Run those down for us.
Easy. Number one, if you're having anxiety, if you're waking up in the middle of the night with chest pain and shortness of breath and having panic attacks, don't try right now. Just wait a cycle. Wait 3 cycles. Let's learn a little bit more about coronavirus and make sure that you're not feeling stressed. If you're someone who's been pregnant before and you've had pregnancy complications, this probably isn't the best time to start trying because in-person visits might not be as available to you. You may not want to be going to the hospital at this time, for example, for IV hydration if you're someone who's experienced hyperemesis, which is nausea and vomiting in pregnancy. If you're someone with comorbidities, for example, a high BMI, let's say you have asthma, diabetes, maybe now also is not the right time to get pregnant. So those are the things that I talk to my patients about. And then there's also the work situation. So there are some women who work in a situation where they can't be physically distanced at work. And so in that type of scenario, or you're a frontline health worker, right? You're an ER doctor or an ER nurse. This is probably not the best time for you to start trying. So maybe take a little break, 1 or 2 cycles, and then reconsider your options at that point.
And then, Amy, let's talk about those women that are pregnant and really worried right now about their own health and about the potential that if they do get sick, some of the complications, or the fact that could they pass the virus along to their baby? What's the situation with that? There have been some studies.
That's called vertical transmission. So when the mom has it, is she passing it to the baby? We don't know. So far, it seems like it's pretty good news, though. It doesn't seem like vertical transmission is happening. And certainly there is maybe there are 1 or 2 case reports out there about vertical transmission. But the news so far seems to be good about women who are infected and pregnant, including, does it pass through breast milk? It doesn't seem to pass through breast milk. So those are some of the things that we're learning. We're learning it out of China. There were a series of 30 women in China, and most of them did really, really well, including their babies.
That's really good to know. Comforting words coming from you. I know how beloved you are in the fertility community and from so many moms. Dr. Amy Evazadeh, thank you for being with us.
Thanks for having me.